Hello everyone, you're very welcome to this University of Galway webinar about the MSc in Podiatric Medicine pre-registration. My name is Niall Horan, I'm part of the Global Galway office. And just before I pass you to my colleague Pauline, just one or two things of note. We are hoping that this is an interactive session, so if you do have any questions, please post them on the right of your screen and we'll do our best to answer them during it. If not, we can refer to them afterwards. This information is being recorded, so if there's anything you miss or want to look back on a later date, you can do so on the Ambassador platform as well. Firstly, I'd like to thank my colleague Pauline Munson. So Pauline is the head of Discipline for Podiatric Medicine and also the program director for Podiatric Medicine. So Pauline is going to take you through the program that are being offered and also field any questions that you may have. So Pauline, I'll hand over to you.
Thanks, Niall, and thank you to everyone for joining us here we are, the 7th of January. So thank you very much for your interest in our MSc in Podiatric Medicine pre-registration that we offer here at the University of Galway. So I suppose one of the first questions people often ask is what actually is podiatric medicine? And there's lots of different elements to podiatric practice, which shows the versatility of it as a career choice. But this definition, which comes from the International Federation, I think covers it in quite great detail. So it talks about podiatry being the profession of health sciences, which is concerned with research, prevention, diagnosis and treatment of deformities, pathologies and injuries of the foot and its associated structures in relation with the body, as well as the manifestations of systemic disease by all appropriate systems and technologies using scientific and professional specialized knowledge. So you can see that podiatry and podiatric medicine actually has quite an awful lot involved in it. So when it comes to our MSc, the question is, well, why should you choose podiatric medicine? So our course is designed to train you to be a high caliber, competent health and social care professional graduate at this level 9 on the Irish NFQ level. So from the point of graduation, we would expect that you would be able to demonstrate high level skills to enable you to become advanced clinical practitioners and managers and leaders. So when it comes to why you should choose podiatric medicine at master's level versus some of the other HSCP opportunities out there, is firstly, this will give you the recognised health and social care professional qualification. You'll get a lot of hands-on training and clinical care, both during your training on the programme and then after graduation. This really is a hands-on programme. The great thing about podiatric medicine is its versatility. You're able to work both in the private sector and in public sectors. You're also available to work in subspecialty groups if you felt that way inclined, and you can work with all age groups. You know, we have podiatrists practicing from the very young all the way up into older person care. And of course, the great thing about podiatric medicine, particularly in private practice, is it gives uniquely flexible working opportunities that can be very family friendly or working in around other commitments. So that's the great thing about podiatric medicine. So that's one of the reasons why I say you should choose to study podiatric medicine. I'm not biased at all. So then why should you choose our program here at the University of Galway? So the program here is kind of interesting in the fact that it is accredited professionally, both in the UK and in Ireland. It is the only program in podiatric medicine or podiatry at this level offered in the Republic of Ireland. All of our graduates are eligible for CARU registration. And for those of you who don't know, CARU is the multi-profession regulator here in the Republic of Ireland, and all practicing podiatrists, along with other health and social care professionals, need to be registered with CARU to ensure standards are met. So again, we're also the only podiatry program on the island of Ireland with international podiatric endorsement. And so we are endorsed, our programs are endorsed by the International Federation of Podiatrists. You can see their logo there. We have strong professional links with both Podiatry Ireland, which is the professional body here in the Republic of Ireland, as well as the Royal College of Podiatry, which is the UK professional body. And as I said earlier, we are accredited by both those organisations. We also have very strong links with the New York School of Podiatric Medicine, and every 2 to 3 years we have a shared conference, the Transatlantic Podiatric Conference, which we had very recently here in October. So again, we do have quite strong links both nationally and internationally, and we do offer accredited CPD programs through the American Board of Podiatric Medicine International, and our academic team would have a very strong links with international representation for podiatry and podiatric medicine. So that's why I would suggest you should choose University of Galway. Obviously, the 200 plus days of rain in Galway are an added bonus. So what does this course actually entail? So the course that we offer at MSc in pre-registration for podiatric medicine gives you 1,000 clinical practice hours of hands-on training. That's with patients or with specific skills in order to improve your ability to safely and effectively treat patients. Our placement opportunities are offered in both public sector and in private sectors of the healthcare system in Ireland. The teaching that you will receive is very much interdisciplinary with academic staff across the College of Medicine, Nursing and Health Sciences. And it is unique in the fact that it gives you this level 9 qualification, but it's also a professional qualification that leads to that registration with CARU, our Irish regulator. I suppose one of the benefits for people who've already completed an undergraduate degree is that this is a 6-semester program, which is delivered over 2 academic years. But it is very much a full-time program. Okay, so in the program, these are our modules, and these are the European credits that are attached to them. So in the first year, you can see there, we've got our podiatric medicine practice module, and that's a large 30 ECT credits that runs throughout the first year of the program. Then we have healthcare practice and leadership practice. And again, that runs across the first and second semesters. Then we have 4 basic science medicines around biology and the pathology of disease and the structure of the foot as it relates to the whole body. And they are delivered with our academic colleagues across the School of Physiology and Anatomy. So there's a good mixture there of content. Then we also have our human motion and biomechanics, and that's all very physics about how the body moves and how the foot plays an important role in that process. And our integumentary system covers an awful lot of the science underlying foot pathology. So that's the first year. And then in the second year, again, we have that large podiatric medicine practice module that runs across all semesters. There's an opportunity to undertake some research, to build on the research that you've done from an undergraduate level. There's also lifestyle and clinical medicine, which looks at systemic disease and how it relates to the pathophysiology and presentation of foot pathology. There's pharmacology there for podiatrists, which leads to prescriber readiness. And again, we look at musculoskeletal medicine across the lifespan. So as I said earlier, that covers from the whole gambit of movement from a pediatric perspective, all the way through to maintaining safe, free mobility in older life. And again, there we have our professional practice, healthcare and leadership, that also runs across semesters 1 and semester 2. So it does cover the whole gambit of standards of proficiency that are expected by CARU. All 84 domains are met across these 2 years. So there's quite a lot in it. So another question that is often asked is, why would I choose to do the master's program versus doing the bachelor's program in podiatry or podiatric medicine? So as I've already said, this program is very much intensified in the fact that it's delivered over 2 academic years rather than the 4 years of a bachelor undergraduate program. And this is partly because we're able to acknowledge and recognize some of your previous life experience that have happened during your previous degree and previous career pathways. So it is also delivered over 3 semesters rather than the 2 that our undergraduate program has delivered. The good thing about the 6 semesters over the 2 years is that it's only level 9 students who are in for semester 3. So you do get that dedicated support from the academic and clinical team in semester 3, and you get dedicated then specialist placement opportunities throughout semester 3. And of course, you do then have the opportunity to complete more advanced research than would be offered at the bachelor's level. So that's kind of the main differences. So in terms of application, application is a 3-stage process for this program, and obviously we do not use the CAO or any of the central admission systems that may exist in other countries. So you apply directly to the university, and there's 3 stages, and I'll talk you through the 3 stages. There's the eligibility for the program, then there's the shortlisting process, and then there is an interview. So you can see here's our eligibility criteria. So, from EU perspective, you need to have a minimum of a 2-1 degree in a cognate discipline in Ireland, the UK, or Europe. And for international students, it's the same degree process, but at the same time, you'll need to prove evidence of an IELTS of 6.5 score overall with no component less than 6. This is purely to prove a proficiency in the English language and the ability to complete your assignments within the level of English that is required both by the university and by the regulator that says you need to have that certain degree in order to qualify. So that's the first stage, which is the eligibility. So then in the application process, these are the things that you would need to upload. So you need to upload your qualifications, your English language where applicable, your personal statement, which would explain what your motivation is for studying podiatric medicine, your passport or birth certificate, your current CV, and 2 written references. So that's what's expected of you. And then we will use those in order to make a shortlist. So the shortlisting criteria, so program director, that's my job, is to read all the applications, and we would then invite shortlisted candidates to interview. So the interview can happen either online or in person. So there's no, you don't have to come to Galway for the interview. We're very happy to conduct those interviews online. And during that interview, we will pick up on anything that we have identified in your application that we want to explore more. So it might be if there's something in your first degree that we're just not clear about how that would relate into podiatric medicine, we might tease some of those issues out, and just to see whether you're able and willing to commit to our BSc in podiatric medicine. So those are and after that interview process, then we would make either a firm offer or a conditional offer, or we would decline your application dependent on that. That sounds quite serious, but we try to make it as friendly and supportive a process as possible. So that's my brief overview of what we offer in our master's pre-registration in podiatric medicine. Here is our email address, and I'm very, very happy to take any questions that you may have either about the application process or the program or anything podiatric medicine related. And thank you for listening. Niall, we'll hand back to you if I stop sharing.
Thank you very much, Pauline. So we have a question in from Varun. I think you did answer it, but he was apologizing. He's a little bit late. So he asked, is it Coro approved?
Yes, our course is very much Coro approved.
Excellent, great to hear. And just a question I had during it. So, and how the course has been running for a while. Can you tell us about some of the alumni and where they've gone, or what the potential is?
So our program, we're coming to the end of our first intake of master's students. So I can't give you any evidence on our alumni because they haven't quite graduated just yet. So they've come to the end of semester 1, just about to start on semester 2 of their second year. So that's semester 5 overall.
Okay.
So, but what I will say is when we one thing that we have done is we've worked very closely with our students, and we engage with them very regularly to ensure that the workload is supported, and we have a lot of internal feedback mechanisms for students and staff to give that extra support.
Thank you. Yes, because I know the undergraduate program, they've gone all over the world since then.
That's very true. They have.
And just in terms of the makeup of the class groups, where are the students that you currently have? Where are they from?
So at the moment in our master's program, most of our students are Irish students who have a degree in something else and have decided to come back because they wanted that healthcare professional qualification. So I'm just trying to think. We've got a couple of nurses on our program. We actually have some secondary school teachers and some sports science graduates. So there's a very, very broad mix of people on our program at the moment.
Okay, so nice and varied. Thank you. And another question from Varun. I do believe you answered this also, but just to emphasize it. In what settings are graduates employed?
So Varun, so I'm talking more from our bachelor graduates. But the joy of a career in podiatric medicine, I know I'm completely biased with 25 years of clinical practice, but it's very flexible. You can work in private settings, you can work in public settings, you can work with children, you can work with older adults, you can work in specialist centers. I have a big history of working in diabetes, in acute hospitals. There really are an awful lot of options. We certainly have graduates who've gone to work with elite sports and athletes, and we do have quite strong links with some of the local sports facilities in Galway. So yeah, lots and lots of opportunities.
It's wonderful to hear. And just again to reemphasize that if you want to watch this back again, and if there's anything you missed at the start, you can do that. You can do that also on the platform. So thank you, Varun. You can of course apply for the next year again. Okay, so if we have no further questions, Pauline did put up the access to the email. So if you have any further questions that you might think of later on, we can do that there. And if not, I'd like to close this off by saying a special thank you, and we hope to see you all in Galway in September. Okay, so thank you very much, and take care, everyone.